Welcome back to our YouTube channel. Today, we are going to discuss about the most important topic, delirium. Before that, kindly subscribe our channel to get the more updates. Delirium. What is that? We have seen so many patients with this condition. Let's see in detail about this. Delirium is a clinical syndrome that usually develops in the elderly. It is characterized by an alteration of attention, consciousness, and cognition, with a reduced ability to focus, sustain, or shift attention. Next, we'll see about what are all the cases of dementia. We have the mnemonic, like pinch me means pain, infection, nutrition, constipation, hydration, medication, environment. Along with these other causes, like a stroke or TIA, certain seizures, or head injury. We know the causes now, but there are also some risk factors there, like being age 65 or above, having dementia, being frail, hearing or sight loss, alcohol misuse. Next, we see about classification of delirium. First classification is hypoactive delirium. Symptoms will be unusually drowsy, or unable to focus or pay attention, quiet and withdrawn, slower than usual when moving their body. Second classification is hypoactive delirium. Symptoms appear agitated or anxious, speak fast or loud, become restless or unable to sit still, respond negatively or aggressively to caregivers, seem watchful or paranoid. Third classification is mixed delirium, a combination of both hyper and hypo symptoms. Do we have any assessment to diagnose delirium? Yes, we have called Confusion Assessment Method, CAM, which contains 4 symptoms. The presence of delirium requires features 1 and 2 and either 3 or 4. They are 1. Acute change in mental status with a fluctuating course. 2. Inattention, reduced ability to sustain attention and follow conversations. 3. Disorganized thinking, problems with memory, orientation, or language. 4. Altered level of consciousness, hypervigilance, drowsiness, or stupor. Other diagnostics measure are blood and urine TS to rule out infection, metabolic imbalances, abnormal blood gas levels, liver function, and drug intoxication. Next one is electroencephalogram, or EEG. This is a test that records electrical activity in the brain. It can identify certain seizure disorders, which sometimes have delirium-like symptoms. Final one is imaging. In most cases of delirium, imaging tests are not necessary. A brain CT may be recommended if the delirium has no underlying cause and does not improve. MRI of the brain may help the doctor spot inflammation or a minor stroke, which may explain symptoms in some rare cases. How to manage the delirium. The underlying cause should be treated, and symptoms of hyperactive delirium can be considered with antipsychotic drugs. Next, ensure hearing aids, glasses and dentures are within reach. They need a gentle and friendly approach, smile, and provide reassurance. We should talk and keep the person informed in short, simple sentences so that they can understand easily. Keep the clock and calendar near to them so that they can orient the time and day. Best one is keeping some familiar objects from the person's home next to their bedside so that they can recall their memories. At last, most important is for the family and friends. Speak up if you suspect delirium. No one knows the patient better than friends and family members, she notes. If you notice something not quite right about your loved one, telling the nurse or doctor is very important. The sooner delirium is identified, the sooner the team can address it. Thanks for watching. See you in the next video.